Hello and welcome back to the Nursing Hustle. My name is Natalie and I have a few jobs for you here. I was checking this out and I found something interesting that I thought I would come discuss. And we're going to start with this job right here. It is a remote job, but this is in Minnesota, right? And this is called an SCA call center nurse. It says remote, but we're gonna go through it together because I just thought the job was interesting. The pay scale is 59.5 to 116.6, and as you can see, this position will assess and coordinate the care for a very diverse population of members of the World Trade Center health program. And so I didn't know a lot about it. So what I did was I did a search to see. This program is run by United Health Group, and just full disclosure, I have covered the story about Brian Thompson, the CEO who was shot on my other channel, and some of the issues with the healthcare system. But, you know, as registered nurses, we still work in this system, right? If you're a registered nurse, I mean, you can choose to work with certain companies or not, but I think that they're all doing the same. So that's just my quick disclosure so that you know that, yes, I have covered this story and I have some thoughts about that I'm not going to share here today, but that I just wanted to make it clear that I have. But still, these jobs are available to us as nurses looking to get away from the bedside nursing and tap into something else that's available. This is covering members throughout the US. Let's just World Trade Health Program. What is the World Trade Center Health Program? And we're just going to check. I think this just caters to the World Trade Center Health Program is a program that provides free mental and medical care to affected people affected by September 11, 2001 attacks. The program also funds research into health conditions related to the attacks. So, you know, first responders and things like that. So I think this is something really noble, especially if the care is free. So my hope would be like that they're not denying care. I don't know what the criteria are, but we're going to move right along and go into this. I just wanted to let you know what that was about. So this position is Monday to Friday, 8 to 5. You can work. Oh, I thought you had to be in Minnesota. You do not have to be in Minnesota. You enjoy the flexibility to work remotely from anywhere within the US as you take on some tough challenges, of course. I'm sure these cases are very challenging, but it is 8 to 5. You work from home. The primary responsibilities are managing an assigned caseload, which entails assessment, education, and coordination of care for members, healthcare providers throughout the United States telephonically while keeping a detailed medical record within internal database. Establish and maintain regular contact with members and providers and department supervisors. So you're basically managing the person's care. Manage inbound and outbound calls from providers to prior authorized tests, procedures related to members. So this involves prior auth, reviewing medical records, generated text, documenting, things that we do as nurses. And you'll be the point of contact for internal departments to answer questions relative to members of their assigned caseload, blah, blah, blah. And now, all you need for this job is a current license, 4 years of clinical experience, Microsoft experience, interpersonal communication and problem solvings. If you're a nurse, you do all that, right? That's what we do. Proven to possess and demonstrate excellent organizational and multitasking abilities. Say what? As nurses, what are we? We're on the floor, standing on our head, talking to the doctor, charting, passing meds, doing it all. What don't we do? Dealing with the patients being angry at us, the families, we deal with it all. And, talk about multitaskers. What? That's the definition of a nurse. Proven to possess and demonstrate excellent organizational and multitasking abilities, proven solid telephone communications. What nurse doesn't have that? If you have to communicate and call the doctor for orders, you got some skills, my dear. So, and proven ability to take initiative and be detail-oriented I mean, like, this just describes a nurse. Like, I don't know, this whole job description describes a nurse. And so they have some preferred qualifications, but we don't always have to have that. National Career Readiness Certificate, I don't know what that is. You could probably look it up. How difficult is the test? Only 3: applied math, graphic literacy, workplace documents are required. And for each assessment, there will be a 5 difficulty level, each one building on the one before. Level 3 is the easiest, with level 7 being the most complex. Sounds like the NCLEX, right? I don't know. It sounds like a test that you take and you get a certificate. So you can look into that. I don't think this would be something that's hard to get. Case management experience, that's what we do. Military experience, healthcare experience. So if you worked at the VA, if you've worked at, if you've done anything in the military, you've been a military nurse, this is, that those are some extra qualifications that you can have. And the preferred qualifications are always the ones that you don't necessarily have to have. But if you have the above skills and those skills, you're probably going to get a good look, right? And it doesn't say here how many full-time positions, maybe 1, I don't know. It doesn't say how many positions they're hiring, but there's a telecommuter policy, but you can see ICD-9 and CPT coding. The ICD-9 coding is what you use in the ICD coding is medical coding for diagnosis coding. So that's usually that's what they use for medical diagnosis coding. So the CPT coding, these are all things we use within the healthcare system, and you can learn over time. Like, if you've done home health, you've seen these, right? We've seen ICD-9 coding for diabetes, congestive heart failure, all the things that you typically see when you have a home health care patient. Let's keep it moving. Like I said, this is the pay range. And based on full-time employment, pay is based on several factors, including but not limited to local labor markets, education, work experience, and certification. No matter where you are or where you begin a career with the United Health Group, you'll find a far-reaching choice. They're selling themselves. This will be posted for a minimum of 2 business days or until a sufficient candidate pool has been collected. So I would say get on it if you're looking to apply. This was just posted, and yeah, I would apply. And there's some bargaining room here based on your experience. For something like this that they're saying is so tough, I probably wouldn't take less than, working from home, I wouldn't take less than 80 or 85 for this, depending on where you live. I don't know. Like I said, you want to consider. And, depending, you might want to go, you can go higher, up to 100, 116.6 is the max that they'll pay for this position. So it just depends on what they need, how bad they need it, and you will know based on your interview. Let me know what you think about this. I'm going to be bringing you more. I'm trying to keep these short and not bring too many all at one time, because I want to show you a little bit of what's available out there that's non-bedside nursing, that is still patient care, that you may qualify for, jobs that you can qualify for with the experience that you have as a bedside nurse. Like, I think that's amazing. I think many of us don't realize that, or maybe we're afraid, don't know how to put our resumes together. I did mention before that I'm working on putting something together that I may help you, and I may be putting together some type of sample resumes, like generic resume that I would put together for, some of these job specific resumes, and the skills and how I would word things in the resume. And yeah, I think I'm going to be creating a private space where we can discuss off of the internet, some of your needs, where I can help. But I will work and figure that out. If you have any jobs that you're looking for, anything, let me know what you think about the jobs that I've posted so far. And let me know what you're looking for, all right? Because I am here to serve you. Well, thank you for joining me today on the Nursing Hustle. Let's keep hustling smarter and not harder. And if this isn't for you, maybe you know someone who may be interested. See you in the next video.